Hi, my name is Brianna Snyder and I'm a Board Certified Behavior Analyst with DiNovi & Associates. This video will cover 5th edition task list items G1 through G9. In this video, I'm going to discuss a variety of skills that should be considered before resuming in-person and community services with your learners. Due to the COVID-19 pandemic, many of us have been home to mitigate any risk of infection to ourselves, our learners, and their families. As things begin to open up and we begin that transition from telehealth to in-person services again, there may be some new skills to consider in the post-quarantine world. With lots of infection control measures in place, it's important for our learners to be able to follow along with those measures as well. Kornack, Williams, Johnson, and Mendes noted some clinical and safety protocols that can be put into place in their article titled Reopening the Doors to Center-Based ABA Services, Clinical and Safety Protocols During COVID-19. This article can serve as a guide for which skills our learners may need to learn before going out into the community or receiving in-person services. So, where do we start? One of the quickest ways to measure the possible presence of COVID is to take our temperature. There are a variety of thermometers out there, but the easiest one is probably the type that can scan a person's forehead. For learners who may have a fear of the thermometer, systematic desensitization may need to be utilized to target this skill. Each intervention is going to be learner-specific, so even pairing the thermometer with reinforcement might allow for an adult to take the learner's temperature. Next up, hand washing. Kornack and colleagues included some questions to consider. Has your learner mastered hand washing as a skill, including thoroughness and duration of hand washing? What antecedents exert control over hand washing? Will the learner respond to verbal or auditory prompts to wash their hands on a more consistent basis? Are there additional antecedents that should be included in programming to exert control over hand washing, such as following touching one's face or touching a doorknob? Prior to entering the community, it's important to ensure that the learner has hand washing mastered, as this is crucial in preventing spread of the virus. At times where hand washing is not an option, hand sanitizer can be used with the following considerations. Does your learner demonstrate use of hand sanitizer using appropriate amounts, thoroughly coating hands, and without ingesting the hand sanitizer? To target hand washing and using hand sanitizer, some interventions may include task analyses, modeling, and chaining. For learners who prefer certain smells, soaps or hand sanitizer with different fragrances can be used. How about general safety risks? Are there risks of your learner touching or ingesting other cleaning products, such as sanitizing wipes? Does the client mouth objects? If you answered yes to either of these questions, interventions may need to be put in place to target these behaviors. In the event that the learner is not wearing a mask and coughs or sneezes, appropriate behaviors surrounding this should be taught. Examples may include coughing or sneezing into your elbow or a tissue. Ensure the learner washes their hands after coughing or sneezing if there is a possibility of any bodily fluids touching their hands. There are going to be many considerations surrounding use of a face mask. Does your learner tolerate wearing a mask? If so, for how long? Can your learner put on their own mask without assistance, including multiple types of masks? Would your learner benefit from a stimulus assessment of mask types to reduce aversiveness of the mask? When out in the community, especially in places that require masks, your learner will need to be able to wear a mask for the entire duration of the trip. In order to target this skill, toleration trials and shaping procedures can be utilized. What about when staff or parents are wearing masks around your learner? Does your learner tolerate other individuals wearing a mask? When upset, does your learner attempt to remove others' masks? Systematic desensitization may need to be utilized to allow for toleration of others wearing masks. Is your learner able to physically distance at least 6 feet from other individuals without assistance? Does your learner require physical prompting, and to what extent? Would your learner follow prompts to help maintain physical distancing? What type of visuals will they need in order to assist with physical distancing? Does your learner follow the directive, stop? Does your learner follow verbal cues when navigating the environment, including directives not to approach other peers? A good way to practice physical distancing could be to have your learner carry a hula hoop around and teach personal space. Additional strategies may include shaping, reinforcement, and the use of other stimulus control procedures. Even if your learner's family is not yet ready to make the transition to in-person services or going out into the community, these are skills that can be taught through telehealth and then probed for generalization once in the community or in person. Thanks so much for watching. For additional content related to this topic, please subscribe to our channel.